two additional meniscal tests that we haven't talked about yet are Thessaly's and eggs. And Thessaly's is actually probably the best of the meniscal tests in both sensitivity and specificity. And we need to do it in two positions, so that way we can look at the anterior horns of the meniscus and also the posterior horns of the meniscus. And this is really mostly you're there to stabilize, and it's an active test that's performed by your patient. So the way that you would do it is you would ask them to kind of hold your hands for stability, and then you would ask them to stand on either their affected or their unaffected leg, pick up the other leg, and then they're just going to kind of twist on it without bending it, in and out, so going to their right and to their left, and they're gonna spin several times as they do it, like 5-ish or so, and you would ask if they experience any pain. And then what you would ask them to do is to bend that stance knee down so they're about a 30-degree angle, and then they're gonna spin again, coming in and out. And as they do that, you're looking for pain for them to be experiencing, and or if you hear any locking, or actually they'll tell you about locking, but you might hear crepitus, if they say that they're catching or anything like that, like all the signs and symptoms that are really common when we're talking about meniscal tests. And when they're standing up, we're looking at those anterior horns, and then when they're flexed down, we're looking at the posterior horns. And the reason why they have to internally and externally rotate, or rotate to the right and left, is so that way we're impinging on the right and the left meniscus. If we just did it standing up, it would kind of be central. So in order for us to get to both sides, they have to be able to spin on that. The next test that is pretty good in specificity, but maybe not as good as sensitivity, is the eggs test. And again, there's two positions that they need to be in. They're gonna start with their feet about 30 to 40 centimeters apart, and then you're gonna ask them to put their toes, so go all the way out, kind of like duck-footed a little bit. And then they can cross their arms across their chest or put them on their hips, whatever's most comfortable for them. And then you're gonna ask them to squat down, so that way they're in about, that's perfect, like 45 degrees or less. They can even go down to 30 and then come back up. And you're gonna ask them all the same things. Did they have pain, crepitus, popping, locking, anything like that? And then what you would do, and for that particular test, we're going to be compressing the medial side. So we're looking at the medial meniscus. Then you have them keep their feet kind of in the same place, but then rotate their toes in so they're pigeon-toed. And then you're gonna ask them to squat again. So their knees are gonna come together and they're gonna come down. And now we're compressing the lateral aspect, and then they can stand back up. And you can have them repeat it a couple times if you want, but now we're looking at the lateral meniscus. So you need to do it both ways so that way you can see. And then depending upon how close they are to full extension down to knee flexion is also going to give you an idea of where the tear is. Again, extension is going to be very anterior meniscus, and then the more they go down into flexion, they're going to be rotating back and impinging more of that posterior meniscus.